Good morning, Chris Ohl, Wake Forest Baptist Health Infectious Diseases, the 13th of May edition for COVID update. I'm not trying to be like Saturday Night Live, but I have a weekend update. I have COVID update. So where are we sitting today? Over the last 3 weeks, over across the U.S., declining cases, we'll take it, including the harder hit areas up in the upper Midwest. I think spring's helping with it, and I think a little bit of tincture of time as the virus makes people immune, either one way or another, either by vaccination or you get the infection, you get immune the hard way. I think that cases are going to continue to decline across the country and hit kind of a baseline across the U.S. Here in Forsyth County, our numbers are also decreasing, but slowly. We're about where we were at the beginning of October, end of September, as far as our cases. Some of the counties around us, the case rates are a little bit higher. Here in Forsyth, we're running at a 10 or 11 per 100,000, which is really some of the lowest we've been since last August. But in the counties around us, they're sitting more around 17, 18. And I can tell you, if you look at the vaccination numbers in each county, it can kind of predict what your case rate's going to be. And here in Forsyth County, we're doing a little bit better in getting people vaccinated than in some of the counties around us. And we'll talk a little bit about that, but that reflects vaccine hesitancy, which seems to be higher in our rural areas. What's going to happen over the next few weeks? I think we'll have a slow decline. The wavelet that we predicted for April happened, and we're started to be on the other end of it now. And then we'll get into the summer. I think we're going to have a pretty good summer. That doesn't mean the virus will be gone, but it means it's going to be a lot easier to dodge it, avoid it, and to keep it from having problems with these big waves that go through populations. Hospitalizations have been stable, though, over the last 6 to 8 weeks. Both hospital systems here in Forsyth County, our numbers really haven't changed much. Our IC numbers are low, but we're still hospitalizing people with COVID. And really, as we've been increasing the vaccinations of people in the last few weeks, those hospitalization numbers haven't budged much. And so it's just a reminder, the virus is going to take advantage of people who have not had immunity yet, either through prior infection or vaccination. And, while there aren't as many deaths, hospitalization's not something you want to be looking for. And it's still in people who are in higher age groups and people who have other underlying diseases. But we're starting to see more hospitalizations for people who are otherwise healthy. And this is because our younger people who are otherwise healthy don't really see the need to get vaccinated for one reason or another. So just a word of caution, because the numbers are going down for our entire communities, and it doesn't mean that there aren't going to be people affected. And if you're the one who gets infected and you end up in the hospital, for you it's 100%. So trying to play the number game really doesn't make a lot of sense. As we get into the summer and the fall, what's going to happen with our epidemiology for COVID, rather than having these big, huge waves that move through large populations that are extremely disruptive, that create, quote, semi-lockdowns and closures of businesses and restrictions, what's going to happen is we're going to start having clusters of infections in groups of unvaccinated people. And these clusters will be concentrated in areas and people who are unvaccinated who seem to get together. And there'll be transmissions that still will occur in places of worship amongst unvaccinated people. in places, bars and drinking establishments where a lot of unvaccinated people get together. And whenever time you have people get together in close proximity who are not vaccinated, that's where we'll see transmissions. One of our biggest unvaccinated cohorts still, as of today, are our kids, those under the age of 16. In fact, those under the age of 18. And so some good news on that horizon, that in the last 2 days, the FDA and then follow up with the CDC and the ACIP said, hey, time to start vaccinating kids because it's safe and it's effective. How safe and how effective, we'll talk about it in a minute. But that's huge to start being able to do our 12 to 15-year-olds. And it's huge because this is the group in our schools that have had the most trouble with cases that pop up in a school, most of which because of home exposures or social exposures outside of the school itself. But when you get a case in a school and the contact tracing is done, you end up getting groups of people who have to stay home and do virtual learning, which is extremely disruptive to the child and also to the family. Having our kids exposed to COVID, while they don't get sick as often, and when they do get sick, mostly they don't get serious infections, that every now and then they do. And who wants to have their child have a risk of getting COVID and potential for a multi-system inflammatory disorder, or just no one wants their kids to be sick. So this is the key to getting our schools back to normal, is getting our kids vaccinated. And we're going to start first with the upper schools, the middle and high schools, because that's the 12 to 15-year-old group. I think maybe the time frame of October, early November, we'll be able to do our elementary school kids, ages 2 to 12. Both of the Moderna and Pfizer look like they're going to be submitting their data for children in that younger group towards the end of August, first part of September. And so it usually takes a month or so to get through the data and get the approval out. So how good is the vaccine in kids? Pretty darn good. Actually, if you look at the trials, there were about 1,200 people in each trial for Pfizer's vaccine in each arm. And one arm got the other vaccine, the other arm got a placebo. There were 16 cases in the placebo arm of COVID. There were 0 in the vaccinated arm. Do the math, that one's easy. That is 100% efficacy. Now, because the trials are, we didn't have as much COVID circulating when these trials were being done. Is it really 100% now? It's probably somewhere between 95 and 100. And so it's really about the same as it was in the adult populations. And so that is a good vaccine in kids. That's a fantastic vaccine as far as efficacy goes in kids. Safety, guess what? Same as it was for the adults, particularly young adults. There are some symptoms that might occur past vaccination, just like they were for adults. A little bit of soreness at the vaccine site, a little bit of headache, some fever, and chills. Almost all these symptoms went away by 24 hours after the vaccine. And they all respond to ibuprofen or Tylenol, so including all the over-counter stuff. So have some of that at home when you get vaccinated. If your child doesn't need it because they're feeling well, you don't need to give it to them. But if they're complaining of a headache or soreness or they have a little bit of fever, then give them the Tylenol or the ibuprofen, and it's a fine thing to do. Why should we be getting our kids vaccinated other than this is the way to get more back to normal? There's 4 reasons as an adult, and there's a 5th reason as a child. Those reasons are, one, protect yourself, protect your child, be selfish, don't get sick. Two is to protect those in the community and your family around you. You create a cocoon. So if grandma for some reason wasn't vaccinated and you're going to visit grandma, if your children are vaccinated, your whole family's vaccinated, then you can have a visit with grandma. You can even do it without a mask, and it's okay. But if she's vaccinated, if she's unvaccinated, you may still want to wear your mask. But anyway, you can do things to protect the loved ones around you. Third reason is to start to have more of normal activities. It's a lot easier to go out and do things when you have the peace of mind of being vaccinated. So you can now go out as a family, have maybe a lunch or dinner, do it outdoors, it's even better. If your child's vaccinated, summer camp looks like something you're not going to worry about quite as much. Day camps, even overnight camps. If you're contemplating overnight camps for your kids, go ahead and get vaccinated. And then lastly is to get the levels up for the community, because as more of our children get vaccinated, it just makes it harder for the virus to slog through and get transmitted in communities. But the last reason is one that's really for the kids, and that is if the child is vaccinated and they get exposed to COVID, either in the school or in the after-school activities or in the home or on a play date or on a sleepover, they don't have to quarantine if they've been vaccinated, which means no virtual schooling, and that is an incentive for the entire family. So lots of reasons to get vaccinated as a child. There are no serious safety concerns that were identified at all in the clinical trials, zero, none. There would not be expected to be anything that would come up different for the kids in that age group compared to that for adults. So I'm very confident, as a parent myself, I would vaccinate anyone that was in my family between the ages of 12 and 15. If they're over 15, I'd have them vaccinated. An adult child, I'd have them try to talk them into getting vaccinated. So anyway, enough about that. There are some events coming up to help get our kids vaccinated. Both of our health systems have ramped up. For here in Wake Forest Baptist Health on the 15th of May, that's Saturday coming up, at the Winston-Salem State University in the Albert Anderson Center. We'll be having a vaccine event with some activities for kids. Hats off to Brenner's Children's Hospital for helping put this together. So no kid wants to get a shot. At least I haven't met one yet. So it's a little nice to be able to have an event that goes along with it that's a little kid-friendly. Appointments are required. The event goes from 8 until 5. And call 336-70-COVID by phone to make an appointment. Or you can go through My Wake Health, I believe. And then there'll be another event on Saturday, May 22nd in High Point on Westchester Drive at the Providence Place Center there. So look for those in our health system. As time goes on, more and more vaccines will be available to children, just as they are in adults, with your private practice physicians and with primary care physicians. So I think as time goes on, we're going to be leaving the events and the large scales and moving it into some of those other sites. Other places, pharmacies. A lot of pharmacies are giving vaccine now, and they'll be doing children as well. And then lastly, their health department here in Forsyth County. The Forsyth County Health Department will have 300 to 600 slots available per day, and anyone over the age of 12 would be okay to get vaccinated at the health department. So where is the ticker for vaccines right now here in Forsyth County? Just under 70% of our over 65-year-olds have been vaccinated, and that's great because that's a really high-risk group. Over 18, we're sitting just under 50%. So you could say that's really great. We're at 50%. To me, that means that half of us haven't gotten vaccinated yet over 18. So it's not too late. We now have 150 some million, maybe even, 160 some million doses given in the US now. That's a lot of vaccine and a lot of arms. Our safety concerns really haven't changed over the last month and a half. Serious events are extremely rare, including for Johnson & Johnson's vaccine. Blood clots now, 28 cases of blood counts out of 9 million doses. So that's less than 3 per million people. So that's a rare event. So safe, effective, and our ticket to getting out of this. You know, if we can get large portions of our kids vaccinated by fall, you're going to have pretty close to a normal school year, particularly for the middle and upper school. And so that's a big deal. And once our undergrades get vaccinated in the mid to late fall, I think then when they can put the mask down and really have something that seems like it was before COVID, hopefully the gas shortage will be over by then. So that's a joke, by the way. Just to cover a couple other things to mention. You know, the FEMA vaccination sites wrapped itself up now, I think, in Guilford County. And we participated here in Forsyth County as a FEMA spoke site. So that's FEMA vaccine with FEMA personnel here in Forsyth County. And that was augmented and put on by both of our health systems here in Forsyth County. In total, we gave 15,000 vaccines, just under 15,000 vaccinations in our county through FEMA. And Wake Forest Baptist Health did about half of those. So I think it was a large success. Majority of those vaccines went to marginalized populations. So racial and ethnic minorities, socially economically disadvantaged. So that's a great thing for our county. So with that, I think I'll just go ahead and open it up for questions for the usual Facebook presentation. Any questions? No? COVID must be getting a little bit better. We don't have quite as much to talk about. So, all right, we'll follow up next week and how things are going for the kids and our vaccinations. Graduation's coming up, and we'll talk a little bit about post-vaccination activities. And I want to really focus next week on summertime, beach, pool, going to camp, going on vacation, maybe even getting on an airplane, maybe even going to Europe. So we'll talk about that next week.